All righty. Thank you, folks, for joining us for our honors colloquium today. I think this is the 5th honors colloquium of the fall 22 semester. It's crazy. We were just talking about how we were halfway through the semester. And yeah, I'm still waiting for it to start. So my name is Craig McCashin. I'm the director of the Academic Honors Program. I'm very excited today to introduce 2 of our presenters. First is Dr. Heather McKnight, who is the director of our nursing program, amongst others, here at A&M Texarkana, and Grace Fant, who is finishing up her dissertation or getting ready to do the dissertation, coming to the end of her doctorate, hopefully very soon. So very exciting. Today, they're going to be speaking to us on development of a nurse research collaborative. So I will get out of the way so you can listen to them. Thank you.
Well, thank y'all for coming in today to listen to our colloquium. Our development of the Nurse Research Collaborative really came out of my time at Christus Health as the McKnight program director. We found our nursing population is predominantly associate degree level. So embedding themselves in nursing research is not something that typically happens with them because they're not taught that within their associate degree program. So when I came back to A&M, Nicole and I sat down and thought, hey, how do we help these nurses elevate their practice, elevate their knowledge, also instill some lifelong learning in them? So the Nursing Research Collaborative was built from that conversation. Forgot to tell you, we did do a modified version of this presentation at the Southern Nursing Research Society conference in February. Mardi Gras. In New Orleans, yeah, we had a good time. So again, looking at our practice partners and what's needed to help with them and grow their nursing population. Barriers that we found with participation with our bedside nurses in research practice is time. They don't have the time to get involved. They don't have the time to do much anything else except for take care of their patients. Resources, again, lack of knowledge because an associate degree nurse is not taught the research process or how to embed themselves into evidence-based practice in a holistic manner. So they didn't have the resources. And again, there's a lack of graduate nurses at our facilities in town, as well as bachelor's prepared nurses to help facilitate that internal process. And that, again, education preparation for those nurses. So we wanted to continue building our relationship with our clinical partners. McKnight standards require, which is the gold standard for nursing practice, your roadmap to do the best for your patients, promote the use of evidence-based practice in nursing research to help do that. So it's embedded into the standards, and our Christus St. Michael's here in the McKnight organization. It's a huge accomplishment for them. So it helps them continue to meet those standards. In town, we looked at different places to partner with for this because there's more than one facility in town. For-profit entities are not really open to this type of collaboration, is what we found in our community, both locally as well as regionally. The reasons that I was given for that is lack of resources, as in monetary resources, lack of time, and typically a lack of buy-in that this was beneficial to their nurse. On the not-for-profit side, again, a different type of hospital structure, still lacked monetary ability to welcome this program into their facility. But the mission and the vision of our not-for-profit hospitals welcomes in how do we collaborate, how do we grow, and how do we build our nursing population. Ultimately, obviously, Christus is a not-for-profit hospital, so that's where we met. We brought stakeholders to the table. So while we think this is great from an education side, our practice partners had to join in. So we had some meetings, talked about what works, what doesn't work, what our vision was, and how do we develop that program. Most of those conversations, fortunately, happened with Nicole, so I was very grateful to her for taking what I had in my mind and running with it. We also now hold a seat on the Research Council at Christus, so that helps us stay intimately involved in the research process there.
So we know that lack of time, resources, and education are barriers to nursing practice, but we also needed to give them some incentives to participate in this research collaborative. And that's where working with our clinical partners who happen to show up today to support us was detrimental to the success of this research collaborative. The chief nursing officer and the clinical education department at the hospital we're partnered with they got together to see what could they do to incentivize nurses to participate in this research collaborative. So they do get paid education time. They get paid to participate in our research collaborative. It's not on their free time that they're doing this. They get 16 hours per month to work on their research project. That's paid time for them, but it cannot be overtime. It has to be not overtime. We have a commitment from their nurse managers. So they get some time away from the bedside to actually focus on their. We also, the hospital approved our research collaborative to provide the nurses up to 27 continuing nursing education hours. As a registered nurse in the state of Texas, you have to have 20 continuing education hours every 2 years to renew your license. So this 27 hours is a huge help going towards our licensure. And the nurses who participate and complete a study get a full paid scholarship to attend an ANCC magnet conference. That's a big deal to get to go to a magnet conference. And we also encourage the nurses who go through this research collaborative to submit their research to this conference. So they're also presenting as well as attending a conference. So qualifications to participate, they have to be a registered nurse, and they can be full-time or part-time. They have to have a BSN degree or higher, or be enrolled in an RN to MSN or doctoral program. And that the reason for that is because our curriculum is just a research overview. So when they come to this research collaborative, they already need to have the background knowledge on how research works and the different types of research methodology. The nurses have to complete their city training for IRB requirements. They do have to complete a research project that is IRB approved. And it's approved as research. It's not approved as QA/QI. It has to be approved as research. And then they have to present to an internal and external audiences. So we present their findings to unit-based councils within the CRISPR system, but they also need to present those findings through peer-reviewed publication or conferences, but they have to know that they have to present their findings. So the curriculum, we developed the curriculum as a 12-month plan. They meet with me once a month, and we meet we meet for 3 hours, and we're reviewing the research process when we're meeting. And then after the first 2 or 3 months, we actually start writing that research proposal. They come up with the topic. These are bedside nurses. They know what works and doesn't work. I'm not in practice as much as I used to be. So I love research, and I'm about to have a PhD, which is a research doctorate, but I need my practice partners to tell me what's working and what's not working. I need that insight from our practice partners. So they come up with topics. They go through the IRB and city training. We develop clinical questions based on the topics they identify that need to be researched. We search through the evidence. They complete a literature review, an integrative literature review as part of their research proposal. Then we do a lot of writing, and we do the data analysis, and I work with them on doing their data analysis and SPSS and determining what statistics are the best statistics to use to answer their questions, depending on their variables. And then we have writing for publication and dissemination. So where are we now? We have completed the first cohort. We had 2 completed studies out of that. One study submitted their results as a journal submission to the Advances in Neonatal Care. And another one has a poster that they will be submitting to the next magnet conference. And then we have our second cohort has started. We were hoping for 8 participants. We started with 8 participants. Some of them have dropped out due to work requirements. One no longer even works at Christmas anymore. So we have 2 open studies right now. And this has really, it's been amazing for me as a researcher to broaden my research agenda. Which I'm typically only focused on stroke care, but these nurses are bringing so much more to me and really opening my eyes, as far as research goes.
So we found some implications for both nursing practice and nursing education through this process. The first one is just really building that spirit of inquiry at the bedside, along with the nurse leaders, along with those of us that are in education. So we want them constantly asking, how can I do this better? What would make the patient outcome better? So we're really cultivating that. And we're seeing it happen first in education and moving to practice, and this practice or research collaborative continues to build upon that. We're seeing improved patient outcomes, which the literature has always supported improved patient outcomes when the bedside nurses are involved in research and implementation. So again, continued improvement there. But we've also enhanced our partnerships with academic nursing and practice nursing through this. While we were in New Orleans, we were approached by some major hospital education systems on how they could take what we were doing and help build it bigger. Almost ran us into, oh, we may need to talk about some copyright pieces of this, which we had never thought about. We've also been asked to share with more magnet organizations how they can partner with their education facilities in town to really build a robust research program. We're also enhancing lifelong learning. We teach that in nursing. As nurses, our continuing education requirements require us to have lifelong learning, but this is giving a whole nother level to that lifelong learning. If you question it, can you find a solution to it? Absolutely. You just have to have the right resources and the right time and know how to get there. Recruitment. This is purely on our side. I'm not even going to pretend it's not. But we are recruiting for our ADN to BSN program through this process. We're recruiting for our graduate programs through this process. We're getting hands-on time with these nurses so they know what kind of educators we are and they know how much time we're going to spend with them. So on very much a personal side, it enhances our recruitment opportunities. The other piece that's not on the slide that we found kind of anecdotally, when Nicole and I were presenting at SNRS, we're both talking about our different levels of doctoral education. We've promoted a totally different conversation nationally now. We are a practice doctorate and a philosophy doctorate. We're showing them how to work together to elevate everything that's going on. Nicole focuses on groundbreaking new things. I focus on how do we take what we're doing and making it better. So we've created a new conversation. Through that conversation, now the Southern Nursing Research Society welcomed evidence-based practice and practice-based research to their set. So for the first time ever in March, I think March 4th, in not New Orleans this time, Orlando, we will host our first section and track within that organization that is focused on practice-based evidence. So challenges that we ran into, it's time intensive. It's time intensive on our side, it's time intensive on our nursing partner side. And sometimes that ran into a challenge. Zoom helped, but competing priorities sometimes got in the way. And again, the lack of MSN prepared nurses within the facility, so there's not a lot of in-house help for those people. So we're running most of that process. COVID, what do you want to say about COVID and a challenge? I think it pretty much says everything for itself, which translates to morale. Here in the academic setting, we have morale issues associated with the pandemic, with our pivot to online learning, what, in 7 days, 5 days, something. We gave it spring break to do it. Same things were happening on the practice side. They were pivoting from normal operations to crisis mode and pivoting back and forth between levels of crisis mode. So the morale kind of shifted, the focus kind of shifted. I'm excited to hear what's happening now within the facility so that they're welcoming more calmer, And we're having a time to breathe, so let's really revisit and bring this back to the forefront. So next, because there's always got to be a next, you always got to do more, right? Conversations have started with expanding this collaboration to all of the Northeast Texas region for Christus Health. That is a long process. As our practice partners know to extend things, but that is where conversations are going with Christus Health. We're also working on a submission for presentation at the 2023 Magnet Conference. We didn't think about this. It was actually brought to us at SNRS by a Magnet appraiser that this absolutely needed to be shared at that venue. So we're working on a submission for that, and as well as a peer-reviewed article submission for the Journal of Nursing Administration. Again, based on the request of Magnet appraisers. So we're really excited about what's happening next. So that's our contact information if you have any questions. But for now, we'll open it up to questions for you guys.
And I'll tell you, we could not do this without our practice partners. We did not have buy-in from Christus. We wouldn't be able to do this. And they have supported this wholeheartedly. And we appreciate that.
I'm yes, sorry, I missed the first part, but what is it that you're doing research on?
Well, there's different topics, so nurses develop topics, and then we research that.
Right. So one of them is on catheter acquired urinary tract infection, so they decrease the risk for those. What was the neonatal one on?
So the other one was burnout in the NICU nurses during COVID, because we all expected the ER and the ICU nurses and the floor nurses to be burnout from caring for COVID patients. So we didn't really think about our NICU nurses and how we took away the family interaction. It was a huge help in a NICU taking care of our preemie babies. So we did that. And then we have another study that is looking into the level of comfort of ER nurses providing care to women who have had a miscarriage and having those hard conversations with our patients that we have to have.
You had a question, Dr.
I
McKnight?
did. I saw one of the things you had on there was patient outcomes,
Mhm.
and I was wondering if the measurement on that was like physical outcomes, or whether there was like a qualitative interview aspect with them.
There's not a qualitative piece to that. We are open. I'm open to qualitative, but a lot of nurses tend to be data driven with numbers, and so a lot of our outcomes are numerical outcomes.
And we do nursing sensitive indicators, so those particular patient outcomes, we have found historically the nurse has a huge piece in that factor. So we look at, again, catheter acquired urinary tract infection, surgical site infections. I mean, there's a myriad of things that we do that there's a national database to monitor. So, other questions? So to kind of expand on your question, while predominantly you'll see here, most of the faculty have a very narrow research focus agenda. Dr. McCashian, I need to know about medieval history. He is my person, right? Within the healthcare professions, we tend to have a broader scope. Nicole loves stroke, focuses on stroke. I focus more on the spiritual aspect of nursing, but also looking at these bedside outcomes really makes a difference. So we're able to pivot. So typically we don't have as narrow a focus within our research agenda.
Other questions, Megan?
Camille?
This would be something you would do after you graduate.
Correct. Our students actually do projects while they're in school as well. Most of our students are not involved in the research collaborative at this time, because again, they have a level that's a little different. But our students in their evidence-based practice course, they do a complete literature review. We expand on that in our adult health courses. So you'll see more of the student interaction with their research as well.
And our classes are experiential learning classes. So if when we have showcases, you can see our students' projects at those showcases.
Other questions? We did have an honor student one time that did, Parker.
Yeah. Pardon me.
Parker did a complete simulation on congestive heart failure as a first semester nursing student. That we were able to adapt, to actually work. Pretty comprehensively. He focused on the pharmacology of that particular piece of the first semester nursing student. So there are options for honors projects within nursing here as well. Makes it a little more difficult, but it's a lot of fun for us.
But the myocardial.
Oh, was it a STEMI? Oh, it was a STEMI, yeah, sorry.
No, that's good. 'Cause that's what I tell people when I recruit. So make sure I'm right. Excellent. Any other questions? Okay, well, if you get
Is there
any,
any on?
I don't see any in the chat.
Nope, none in the chat.
Bianca.
Yeah.
Well, if you do have any that occur to you, you're welcome, obviously, to reach out to our presenters. Otherwise, let's go ahead and say thank you. Lunch. Thank you, folks. I'll end the
You can do
recording.
that.
Yeah.
Okey-dokey.
I'll go ahead and get this posted on our YouTube channel.